Hey, Prakis, how's it going? It has been a little while since I've done a 2-minute tutorial, and I was really excited to get back into it after having a little hiatus. So today I wanted to have a chat about a conversation that I ended up in yesterday afternoon in another group. Um, about what to do with someone that's obese, and there was some asymmetry with what was going on with the apron of this obese man. So, aside from obviously pretty extensive case taking and trying to work out what's going on with asking questions and things like that, there are a number of physical examinations that could be done in this situation. Okay, so first of all is when we are thinking about the human body, obviously, theoretically, one side of the body should be the same as the other side, right? So we're always looking for symmetry bilaterally. As we know, in reality, that is not always the case. There is slight anatomical variations in the human body that we can just go, that is completely non-pathological. But if we are encountering, in this case, there was an obese man, and one side, the left side, was visibly enlarged of the abdominal area, as opposed to the right. So when we're seeing these things and it's very, very marked, there are some things that we can sort of do. In this case, with this man, we are going to go through a full abdominal assessment. So that is, first of all, we are inspecting the area. So we're going to get the man up on the table, and we'll have him lying down or maybe sitting in the chair if you don't have that available to you. But you are going to have to expose him and drape him accordingly to try and make him as comfortable as possible so that you can inspect the area. What are we inspecting for? So obviously we are looking for how much of a pronounced difference there is from one side to the other. We are looking for colour. So is there any redness? Any redness? As we know, redness can be associated with inflammation. Is there any blue or purple? Purple being stagnation and blue being lack of oxygenation. And also, please be aware that when we are talking about areas where there is hair, we might see a patch where all of a sudden there is no hair growth, and that's when we're going to be asking questions. I mean, obviously there's people that shave and wax and all of those things, but if they turn around and say, no, I have no idea why there's no hair growth in that area, well, we immediately think to ourselves, well, why? Because for hair to grow, there needs to be a blood supply. And if there's not a blood supply underneath that specific area, well, what's going on in that area? Now, when we are inspecting, especially with a situation with an obese man, this can be quite a sensitive thing to do. This can be very confronting for them. It can be very confronting for you as well. Please don't make that a situation where you don't do it. So the idea is that you have, if it's an initial consultation, you've settled them in, you've got them feeling good, you've given them a cup of tea, you're about halfway through the consult, they're feeling a bit more relaxed in your presence, you've built a little bit more of a rapport with them. Otherwise, it's in the subsequent consultations where they're feeling a bit more confident, they're feeling a little bit more connected to you, and they're not going to feel as embarrassed. But more importantly than that is for you to maintain your professionalism. So if you are presenting exactly the same as looking at the abdominal area of the morbidly obese person as you would with the slim person, it's not going to give off an energetic weirdness. But what I encourage you to do is make sure you're doing this so that you are helping this person identify the red flags. So we've inspected. The next thing you're going to do is you're going to listen to the abdominal area. So obviously I talk in my courses and my trainings, I talk about the 4 quadrants, and you may or may not be aware of these quadrants. Hey, Nick. You may or may not be aware of the 4 quadrants, but the idea, or obviously the 4 quadrants of a morbidly obese person is going to look very, very different to the 4 quadrants of a slim person. Nevertheless, you are going to listen. When we are talking about auscultation, what we are listening for is we are just in very simple terms, we're listening for bowel sounds. Bowel sounds can be gurgles, they can be tinkles, it can sound like cascading water, it can be really big, long groans. And they are the things that we're listening for because it's very, very normal. It's a transit centre. There are things moving through there all the time. We want to hear sounds. Now, we don't want to hear too little, and we don't want to hear too much. I really go into all of this extensively in the course and show you how to assess for hypoactive, hyperactive, and also absent bowel sounds, which is a medical emergency. So when we are, in this case in particular, when we are auscultating the abdominal area of the obese person, we are making sure that we are starting in that lower right quadrant and listening over that ileocecal valve. And then if we're hearing some sounds, we're just going to keep listening, and we're counting that sounds for that full minute. If 5 to 30 is the bowel sounds that we want to hear, anything under is hypoactive, anything over is hyperactive. And as I said, I really deep dive into all of this and how to do absent bowel sounds in the training. Okay, Nick. Yes, after your training, I've started doing more abdominal palpating. It brings up some interest. Yes. And that's such a perfect thing to talk about, Nick. You're going to feel clunky. You're always going to feel clunky doing something that's new, but you are always going to uncover something. Okay, so back to the obese person. So we have now inspected, and now we have auscultated to see that there is a normal range of bowel sounds. The next thing that we're going to do, and we always make sure that we do this in this order, is we're going to be palpating for lumps and bumps. We can feel constipation and feces underneath your fingers, and in particular we're just checking with red flags, as well as feeling for any pain and tenderness. This is super, super important. And please be aware that, when we do our light palpation, which is first, we're only going in 1 to 2 centimeters. Then we do our deep palpation, which is usually about 5 to 8 centimeters into the abdominal area, the quadrants. And please be aware, with your larger people, you are going to have to push down further. So 5 to 8 is for a normal size. With your morbidly obese person, you actually may find that you have to go down maybe even 10 centimeters. And that is a really kind of fair distance down into the abdominal area. Yes, so that's super, super important. Please, please don't leave these things unchecked. The next thing that would be really important to do for this case would be checking for ascites. So ascites is a condition where there is accumulation of fluid in the abdominal area. There are several causes for this. And some of the most common causes are a high blood pressure that's associated with cirrhosis as well. So tuning in when you're doing your palpation, and also checking your liver palpation and your spleen, because remember I said that this man actually has enlargement on the left, which is up in that left upper quadrant is where our spleen is. I go through all of this in the course, in the training. So you are going to be making sure that you feel for that. So when you're checking for ascites, when we check for ascites, which is super, super common in obesity. And as I said, really, really common with people that have cirrhosis. Now, this can be a chronic cirrhosis, or it could actually be just they are in the early stages of. So checking for this, for ascites via this fluid wave, where, long story short, as I said, it's all in my training, but you basically place the ulnar surface, so the pinky side of your hand, into the middle of the abdominal area, and you're going to give the other side, the side of an abdominal, doesn't matter which side, a really big slap. Please warn your patient that you're doing this. Now, what will happen is that you will actually, by slapping the side of the abdominal area, you are moving fluid across, and you will actually feel that shock wave against your hand that's placed in the middle of the abdominal area, and that is positive for ascites. So you're doing all of these things. Oh, I've just mentioned blood pressure. Please check blood pressure manually, correctly, with the palpatory method to make sure that you're getting it done correctly. Very, very, very important in obesity as well, and especially when we're thinking that there are all of these comorbidities like ascites and possible issues with either lumps or bumps or tumours or whatever might be going on under there. And then, of course, when we are dealing with obesity, we are going to be keeping an eye on BMI. We're going to be doing the waist-hip ratio and keeping an eye on that as well throughout our treatment plan to make sure that this person is heading in the direction that we want them to. So when we do these things, and this is something that I want to clear up and I bang on about it all the time, is when we are doing these things, we don't need to have all of the answers. We just need to know what's normal. We just need to know how to do these techniques. We just need to know how to do these examinations so that we can go, something's not normal here. And that's when we can either ask more questions, gather more information, and make our own differential diagnoses and hypotheses about what's going on, or we can refer for further investigation. And I promise you, your patient will be so, so happy that you have taken the time to do all of these things, even when it can be a little bit confronting sometimes, and really just, put on that professional hat and served your patient in the best way. So I hope that was helpful. Let me know what you think. If you have any questions, just ask. And I'm back doing weekly tutorials on different things. If you have a case that you are thinking you would like to have a little bit more guidance about what to do with the physicals, please, let me know, and I can do a 2-minute tutorial on it. I've got some really, really interesting things coming up for next year. I am starting to plan the next round of workshops, yay! And it's going to be super, super exciting with lots more inclusions. It's going to be really exciting. I thought I would talk a little bit more about the pathology testing and things like that go alongside the physical examinations, because I feel like people get a little bit lost with that too. And that is something that I have taught. Okay, have a great day. If you have any questions, let me know, and I will see you later. Bye. See you, Nick.